Welcome to the Aesthetic Angle, presented by Monarch Plastic Surgery, Kansas City's #1 resource for all things cosmetic, wellness, skincare, injectables, and of course, plastic surgery. I am here today with Ashley Williams, one of our expert nurse injectors, and one of our expert estheticians, Jess Hager. Thank you both for coming. Ashley's been injecting for about 12 years, with Monarch for 8.
Yes.
Jess has been an esthetician around 17 or 18 and has been at Monarch for 12. Mm-hmm. Awesome. And today we're going to take a deep dive into beef tallow and snail serum.
Oh, no.
No, I'm just kidding. We're going to cover how our different specialties complement one another and how it's important to keep things in perspective and how we can cross-pollinate to provide the best results for patients that come to us for different aesthetic concerns. A great way to sort of unbox this, I think, in my mind, is thinking of patients that I've taken care of that I have either sent to or received from either of these lovely specialties. I'll talk about my own experience first. I had some darkness under my eyes initially a couple years ago. And I went to a nurse injector at my previous job. I was like, I just don't want to look as tired. And I was like, I don't know what I need. Which is how patients come a lot. Mm-hmm. And they'll show up at any of our appointments. They're like, I don't know. Tell me. And we did a little under eye filler and I had a great result. I have it pulled up here. I'll share it and we can have it maybe we can show it on the video. But I loved it. I just looked rejuvenated. It did improve the discoloration there and it improved some of the volume deficit I had in the tear trough, which, as a surgeon, when patients come to me with that, if they're in their mid-30s, as I was at the time, I'll often say, you can get filler for that, and that would be great. I mean, it's outpatient, quick procedure. You can do a little bit and see if you need a little more. Sometimes discoloration might be improved with something in Jess's department. Jess, what might you offer for that?
Well, sometimes the darkness is a little trickier because it can be vascular, it can be hereditary, and those are things that we fight against as we age. But I usually always recommend a really good high quality eye cream that has some sort of a vitamin K in it because that really does help suppress the vascularity. But for treatment wise, lasers. Yeah. Good eye cream, even if they go into surgery or if they go do injectables, they're still going to need product to maintain at home. I always say it's like, going to the dentist. You go to the dentist for the deep cleanings, but you just don't rely on them to keep your teeth clean. Totally. You've got to go home and you've got to do the work every single day. And so that's product. You touch your skin every single day. So the things that you could be putting on it will only help enhance your surgery or your injections or your skincare treatments that you do. So you'll benefit in the long run by doing that. Yeah.
And then as a surgeon, sometimes I'll have patients come the other direction who maybe thought they just needed filler, but they really need lower eyelid surgery, right? Mm-hmm. Or maybe they don't need lower eyelid skin excision like a blepharoplasty, but they might need fat grafting or something that maybe a little more volume than they might be able to provide with filler. Does that sound fair?
Yeah, absolutely. I mean, sometimes it does have to do with skin quality. Sometimes it has to do with the fat pad kind of starting to pop out over the ligament. That could be actually mid-cheek restoration instead of under eye. Sure. And sometimes it's so significant that it's going to be surgery. Sure. Where no matter what I do, I don't feel like they'd be at the point where they're happy and or there would be more maintenance involved. Where if I'm even thinking, I feel like you are a good candidate, I at least present it. Yes. They might not be at that point where they're open to hear it yet, but at least I am opening that door as, you might get the best long-lasting result with something like surgery instead of something that might be a little more temporary that I can offer. So is that something that you are open to? And if not, then I can tell them the limitations that I might have or the maintenance that's involved. If they are open, then usually I will suggest okay, well, why don't you go ahead and just schedule a consultation first? See what the surgeon says, see what the downtime is, what the cost is. If all of that actually sounds good to you, then great. Right. that was easy.
Yeah.
It's going to last you a lot longer. You're probably going
Right.
to get a lot more of like the correction that you want. If you hear what they have to say and you appreciate the information, but you're not quite, it's more downtime or more cost or whatever, then I'm more than happy to see what I could do with less aggressive option.
Yeah, I love that.
It's funny that you mentioned that, because that's kind of the picture I paint in some of my new patient consultations as well. Is, sometimes they'll come in and they'll be adamant, like, I do not want injections, I do not want surgery. And so then, I paint the picture super big. This is what I can offer you. This is the downtime, this is the protocol, this is the maintenance, these are the skincare products that would go really good with it. And if they're on the fence of like not opposed to, putting their foot in your guys' direction, then I will open it up even bigger. And I said, you know what, it'll be worth the consult with one of our nurse injectors. And then she'll paint the picture big for you and give you pricing. And it's worth the consultation with the doctors too. That way you've got all of the information out in front of you and you can compare which, path you want to go down when you've got all of the pricing and everything kind of laid out for you. And sometimes I think that helps when you're trying to make a decision, because some people want the one and done. Some people don't want to do the long haul, and some people do. So it's just nice to be able to have options
100%
that they can look at.
The quality of skin with you impacts what I do and what he does. So,
100%.
I mean, if you can improve the quality of skin and you're happy at that point, great. If you are improving the quality of skin or pigmentation or things like that, and then there's still these lines that are not getting better, that's usually more muscle movement, which is, lasers are not going to impact your muscle movement.
Right.
So
No.
that's going to be more of a toxin. If it's more hanging or volume
they come in and be like, what can you do for
shadowing.
this?
Yes.
And I'm like, well, that's down the
surgery.
hall. Well, I don't want surgery. I'm like, well, I can't do
Yes.
this.
Because I also get that.
You would be
when I
very
do
disappointed.
this,
Yeah.
Right.
It's
Yeah.
better.
Yeah. Like, well, of course, if we all walked around and did this all day. Yeah.
That's
Yeah, but I've
surgery.
read that filler can lift things, right?
Yeah.
No,
Well.
I mean, I would never say that it would lift. I always under-promise when it comes to that. And hopefully we would get a nice result with a low amount of syringes and fillers. That's always my goal, is to try to do the least and know that we might need to build up upon it. But there is a point when it's just, okay, are you open to surgery? Because what we're seeing down here, I could improve upon.
Right.
But really, the cause is you need to be pulling some of that back.
Yeah.
So,
That's
again, coming back to what are you open to?
Sure.
Because I do feel like this might be a surgical intervention. But if not, I mean, I can make improvements. It's just not going to be the same as surgery, and there'll be more maintenance involved.
And painting the picture super big is really important. It's something I've learned to educate my patients on throughout the years, is because, I know that the lasers and the microns and the needles and everything are going into the skin and creating these channels, but I can't predict exactly how, and this is probably with surgery too, I cannot predict exactly how you're going to respond. You could have a great response, and that's how your body responds to things, or you could take forever to heal, or you could need more treatments than, my standard recommendation. And those things are always hard to predict. And I'm sure with surgeries and injections with bruising and the healing after surgeries, more times than not, you can get back to work, you're back up on your feet. Well, that wasn't the case with my tummy tuck. Gosh, I felt like I could have taken like 6 weeks off of work. But everybody's so different. You can't.
We'll cut that part out.
Oh, yeah.
It's only 2 weeks downtime. No, I'm kidding.
It's only 2 weeks downtime. I felt like I was walking like a troll forever.
I know, I'm kidding.
But
The result was worth it.
the result was worth it. Absolutely. Absolutely it was. Oh, it was worth it completely. But you just can't ever predict how somebody's going to respond to something.
Yeah.
That's what's hard. So it's just painting that picture super big for somebody so they can have realistic expectations, so they're not coming back at you and be like, well, you said,
Right.
that way.
With some injectables, you can provide an illusion of a little bit of a lift, right? with facial balancing and things?
Yes. An illusion is correct. We can reposition fat pads.
Yeah.
So especially with filler, we have deep fat pads that are attached to the bone. They do not move as we age, but they deflate like a balloon. So sometimes we see fat pad changes in that depth. Then there's the muscle layer. Above the muscle, but under the skin, is the superficial fat pads. Those fat pads, when we're young, completely cover our face, and we don't see any little weird shadows or anything like that. But as we age, they shrink in size and shift down the face with gravity. So that's when we start to notice these under eye bags. That's when we notice the jowling starting, folds. All of that is due to the fat pads changing at different depths. So what the filler can do is reposition or replace fat that is changing in those fat pads. We typically want to start with that foundational layer, that deep fat pad, and that's what is going to kind of anchor back and slightly pull back a little. It is not going to be the same as a facelift, but we can see some really significant changes with filler. Now, less is more. 1 syringe of filler is 1/5 of a teaspoon. So a lot of times, if we are really truly doing a facial balancing sort of thing, it does involve multiple syringes of filler. Now, that can be done in a very conservative, flying under the radar sort of way, but I feel like we are at a point where our patients are a lot more savvy about things because it's talked about a lot more on social media, and they still can't always get past that filler face. When they hear the word filler, they immediately go to, no, I don't want
big lips, big cheeks.
I don't want puffy. And I'm always like, well, have you looked at examples of our work? That's just, it's
have you
not
looked at me?
Well, yeah. I mean, I've had filler. I've had
but you look natural.
Right. I mean, that is
rejuvenated.
The goal.
Yeah, right.
And you really just don't realize how often you are talking to someone who has had it done in a very nice conservative way, and you're not picking up on it. It's the people who it's noticeable. That's what you notice, and you feel like that's what it looks like to have filler. And that's really, that's not the goal.
Yeah.
It's not our goal.
No. No.
But it does mean that we might be talking about 4 syringes, 5 syringes to get to that nicely repositioned look that still is not screaming filler. So when we talk multiple syringes, it does scare people. But it doesn't have to be scary. The last thing I want is someone to be leaving my room and looking done, where they have friends asking, who did your filler, but not in a good way. It's like, I don't want to go where you went, sort of thing. I don't want that. I want people going, your skin looks good, or your makeup looks good.
You look refreshed. What did you do?
Yeah.
What looks different? Yeah. That's the best compliment you can get. Like, you've done something. I just can't quite put my finger on it.
Yes.
Yeah.
Having someone not notice my work is the biggest compliment.
Who usually says those things to you? Men or women?
Women for me.
Yeah, women usually are the ones that compliment.
I am afraid to ever say that to a woman, basically.
Why?
You look
well, that implies... Yeah, exactly. That.
Okay, now you have to, though. Now you have to. So say it.
What?
Say it for everyone.
You look really good today. You look really good today, Ashley.
Thanks. You look refreshed.
Did you do something?
Did you sleep last night? It's like when somebody's like, oh my gosh, your hair looks good today. I'm like, well, I washed it last night.
Right.
I actually washed it.
I cleaned it. It's the only time somebody compliments me on my hair.
And that often has backfired for me personally.
No.
Probably for a lot of men, if there's any listening out there.
Yeah.
Maybe I'm
It is other women complimenting other women usually.
Okay.
Yeah.
Okay.
Yeah.
Yes.
Got it.
Yeah.
Just curious.
Yeah. It's a majority.
Yeah.
It's a majority.
But along the illusion effect, it's a good comparison with, for me, a breast augmentation patient, because they often, if they want volume, they don't know if they need a lift or not. And an augmentation alone can often give the illusion of the nipple coming up because you're filling out the lower pole of the breast with an implant. And I'll tell tell that to patients, and I'll show them a before and afters, and they're usually often impressed at how much sort of lift you can see after an augmentation. But it's not a breast lift. It's not the scars of a breast lift. Just like with filler and facial balancing, you don't have the scars of a facelift, but you have a bit of that illusion there. So anyway, interesting.
But we can't make that illusion with one syringe of filler.
Understood.
Or one laser.
Nor one breast implant. You usually need two.
Yeah.
Can I just come in for one?
But it can be a journey, I think, definitely with what you do and with what I do. Maybe you might be more in the kind of one and done sort of situation, not forever, but it's not like, okay, we're going to do this surgery and then we're going to revise it in a couple years and then we're going to revise it in a couple years.
It's more permanent. I hate to use that word. But
with what we do, it is a journey of, okay, this treatment is going to give you a really nice result, but it doesn't mean that we might not need more.
Yeah, you got to maintain.
And if it's appropriate, then we will add more. And I say no to people all the time, especially
I was going to say, do you have
filler.
people like wanting more than what they need? Like they want those big lips that they see out on the streets and
or
their face not to move completely.
Yes, for sure. And
freeze everything.
I have to set that expectation of, my goal is not to freeze your face. So when someone comes back and they are slightly moving, but it's not creasing, they feel like I shouldn't even be moving. I'm like, no, that's actually a really good result.
It's called emoting.
Right. You are still able to show emotion, but you're not leaving lines in your skin. And that, in my mind, like that's actually a wonderful result.
Right.
It's not that you've had Botox look.
Yes.
It's like, have you had Botox? Your skin looks really good. So I do have to set that expectation sometimes of, having some movement is okay. But if you have movement and it's creasing still, that's different. That means you do need a little more. And when it comes to filler, I oftentimes will have people come back, especially with lips, where I will prepare them that it could last around a year. Well, they come back at a year, and I look at them, I'm like, what are you doing here?
This still looks good.
Your lips look really good. And they're like, no, I think so too. You just said it was going to last about a year, so I'm here for more. I'm like, no,
we don't need more.
No, it looks good. As long as it looks good, we're going to ride that out. So setting that standard of, it's not about a time frame. It's about if it looks different in a year, if it looks like you're starting to see some asymmetries that weren't there previously, or you're starting to see that your lips are actually thinner or anything like that, then it might be appropriate to add more, but less is more.
Yeah, agreed. I learned on this podcast with the one with Dr. Hodge and Kirsten, shout out to that episode, that filler, they have MRI studies at filler that shows it can stick around for like up to 3 years. Is that right?
And longer sometimes.
Yeah, which I didn't know.
Yeah.
I'm in the 1 year, I came, 1 year after my under eye filler, I was like, hey, I think I need more. And the injector was like, no, you don't. It still looks good.
Yeah. Exactly.
And that was 2 years ago, and I still haven't gotten more.
Yeah, but as long as if it's not showing evidence of being there, it's not a problem. So I don't want that to scare people either, of like, if it lasts years and years, if you don't see lumps or bumps from it, or if it's not pulling fluid, like looking swollen in an area or anything like that, if anything like that happens, then we need to dissolve it. It is fixable. You're not stuck that way. But if not, just because you still have filler hanging out there, as long as it looks okay, it's fine. It's not hurting anything.
Sure.
So yes, it can last longer than you might think. So even more of why, if you're wanting to avoid pillow face or filler face, we don't want to just keep adding more just because of a certain time frame.
Yeah, 100%. Exactly.
Yeah.
If it was new to me, I'm sure it's new to listeners as well, some listeners. So it's good information. One type of patient I want to mention is the facial rejuvenation patient that comes to me, and I'm their first stop, and they're in their 60s, they've done nothing. And some of that, the ones that will go over and have an esthetician consult, be with an injector, are some of the ones that you can bring them so far when they are able to do things with each specialty. I mean, they're able to get benefits that can be subtle in each area. even for me, if it's not a facelift, it could be other, subtle surgical things, but then you combine that with some laser resurfacing and some volume addition. And they can be so happy because they're like, I thought I needed a facelift and you told me I didn't. I did these other things and this is way better and I didn't have the downtime. And
yeah.
So anyway, I just love that, able to, offer such a wide array of options.
But even a facelift can improve laxity, but it's not going to change texture.
Exactly.
It's not going to change static lines. So it does all complement each other. You can get a facelift, but still need
100%.
to have lasers and still need to have Botox to really.
And people, I feel like the general public is more educated now on what a facelift does, but I feel more often than not, they're still saying, well, wait, what about these lines around here? I'm like, well, this is
affect,
exactly.
Yeah. Well, if you're going to invest that kind of money and time, you want to be able to make it last longer or take care of the health of it, and by doing other things to make your skin quality as healthy as you possibly can. Because I certainly can't turn back the clock, but I can help you age gracefully and slower and help take care of the health of your skin.
I think you can turn back the clock a little bit, Jess.
You think? Okay, well, we'll go with it.
I've heard the comparison before of it's almost like paying for a very expensive pillow, but then leaving this ratty old pillowcase on top of it. Like, what's the point of that? You need, you want
a nice pillowcase.
Yes.
Yeah.
Satin.
So you are getting that foundation, but then also the nice outer layer as well.
I love that. I'm going to use that analogy.
I love a good analogy. I can do analogies all day. Mowing the lawn, dentist. What else is my other one? I've got
What's
a
the
lot.
mowing the lawn one?
Oh, with like laser, when I give the description of what a laser peel versus profractional does.
Okay.
Like laser peel is like essentially mowing the lawn where you're cleaning down the entire surface, but then profractional is like aerating the lawn. Pokes all those tiny little holes in there. So it leaves some treated areas, so anyway, helps with texture.
Love it.
Love analogies.
The profractional would be like the big treatment, right? Because you aerate once a year, right?
You aerate once a year, yeah.
Then you mow more often. You have the other treatments less often. What was the other one? The laser peel, micro laser peel?
Micro laser peel, profractional. But then I also use the aeration for microneedling too, because microneedling creates thousands of little microchannels in the skin to break up texture and indentions and stimulates collagen and all that stuff. But then when you poke all those holes in your skin, just like when you aerate your lawn, you seed it, it's going
Seeding
deeper.
would be the exosomes or what?
Exosomes, yes. Growth factors and just your products in general, penetrate into the skin significantly deeper when you've got all those channels open. So.
That's a good analogy.
I love analogies. I think I've said that. We can probably edit some of those ones out.
No, that's helpful. Do you have any good analogies, Ashley?
Well, the pillow one, that was a good one.
Oh, yeah.
Yeah, I guess I started that one.
Yeah, you did start that trend.
That's my turn to
I like
contribute.
Or like when you change the sheets on your bed, like when I'm talking about exfoliating the skin. When you change the sheets on your bed, you want clean sheets, you just don't put clean sheets on top of the dirty sheets. So kind of like the pillowcase thing where, you're just putting clean on top of dirty and then you just stack it up. No, you take the sheets off and you put new sheet and you smooth down the surface. Right, you got to clean it.
Yes.
Just like you do your sheets.
I use the a bed sheet analogy for submental liposuction with energy, with Renuvion. Because if they're like their complaints right here, you're like, well, it's like a bed sheet. You will do liposuction to remove some of the fat, but then the energy device through the whole sort of area. Because if this was a crease in your bed sheet, you wouldn't just go push on the crease. You would treat the whole sort of bed sheet to smooth it all out. So
see, there we go.
That's the energy.
Yeah,
I did have one.
You did. You did.
You did it.
Now you have more.
And I have more.
Pull out of your back pocket. Yeah.
So glad we did this.
Analogies.
Any other final thoughts on how the different specialties complement each other? Cross-pollinate?
I mean, really just that you could do one.
You could start here, then go there, and then go there, or you and then
But
me.
almost
It doesn't
always,
matter. You always need
if you're really wanting your best result, it's going to be involving at least two of the three areas to really improve overall skin quality, foundational changes, pigmentation changes, that just one of us would not be able to address everything.
Yeah.
Which is so nice that you guys are so much in arm's reach and down the hall, and it's accessible for patients to make consultations and have those options.
Yeah.
So
Yes.
it's
Agreed. It is lovely.
it's pretty fun.
Yeah. And we can do specials between the different things and stuff all under one roof.
Well, and
Yeah,
collaborate
super fun.
too. There's
Yeah.
times where I'll go down to her and just show her a picture of something and ask if there's, anything that she can do. And that way we are trying to give our patients the best outcome that we possibly can while setting realistic expectations. But it's just always nice to be able to pick each other's brains on things, just to be able to, kind of figure this puzzle piece out for them.
Yeah. I think I'm grabbing an esthetician or an injector for one of my patients to consult at least once a week.
That's good. Yeah. That's
least.
awesome.
So,
Yeah.
That's great. Love it. Well, thank you for joining us today for another episode of The Aesthetic Angle with Monarch Plastic Surgery. We'll look forward to next time. Thank you.